Hi, my name is Shakira Blackwell. I'm the housing coordinator here at Action Wellness. I'm so proud to say that the housing team has had so many client success stories throughout the last year. It's really what I love about housing is that you're able to assist clients in such a tremendous way and see a massive impact on their life. But one story that sticks out to me is most is our client, let's just say his name is Tom. Tom came to us and he had lost his job. He was exiting an abusive relationship with his partner and he was in the shelter system. And he was really anxious about it because he knew he was able to work. He just needed safe and affordable housing to restart his life. And Tom was linked with one of our intensive case managers, and we really had the opportunity to see him blossom over the year. He was able to sustain not one, but 2 jobs working with our intensive case manager and our vocational case manager. They were able to link him to those services. He was able to secure safe and affordable housing in a totally new neighborhood, and he really flourished. He was able to be adherent with his medication and his medical appointments, and the goal of Rapid Rehousing, which is the program that Tom was in, was to be able to sustain at the end of the program, and he did brilliantly. He was able to save, and he was able to not only secure his housing for the next year, but he was able to pay some of the initial moving costs on his own and maintain a savings, and he is still doing beautifully. Sometimes he calls to just check in and let us know how he's doing. He's able to maintain both of his jobs. He has not been found by his previous partner, and he's really able to flourish. And it's one of the things that I love about the housing program. So one of the major barriers that the housing department has experienced due to COVID-19 is the availability of units. So on one hand, we're happy that the CDC and the city of Philadelphia, realized that housing was an important access point for healthcare, so they, implemented this eviction moratorium. But that means that units were not available for our new clients that were coming into the shelter system because people were staying in units. No one really knew when the pandemic first hit what that looked like as far as viewing apartments. We didn't feel safe viewing apartments with people still in them. And clients were panicking because 99% of our clients that were coming into our housing programs were in a congregate setting sheltering. And so they didn't want to be there, and we really had a hard time moving them out quickly into available units because things were at a standstill. Property managers were not in a rush to show units. People who were in units were not exactly thrilled about people coming in to look at their units, and clients were in a panic because they wanted to get out of the congregate shelter setting. So that was really a major setback. And to be honest, it still is a setback. I think one of the biggest needs of the housing department is units, landlords who are willing to work with the housing programs to ensure that our clients have safe and affordable housing. We really are at a desperate time because we are not able to find many units, because even though the eviction moratorium is not on, evictions are backlogged, landlords are overwhelmed with trying to manage, I guess, with our new normal. I don't want to say the pandemic is over, but with our new normal, everything is backlogged. So we find that property managers are having a hard time finding materials to turn over units. Even with some of the things that we've experienced with Casa Nueva Vida, it's the availability of materials to turn over units is taking a long time. Shipping is taking a long time. And so things are just delayed, whereas we used to be able to find clients housing within 30 days. It's taking 90 days or more, just because of the traffic jam of turning units over, finding units that are available. So that is a serious need for the housing department.